Again, we have a presentation this evening by Health Alliance regarding the master plan for the Burbank Hospital. Pretty much set up, I guess. Is there someone who would like to...
We put together some agendas for you just to keep focused. This does not mean this is the extent of what we can talk about here tonight, but because we could go on and on, we want to be sure that we stay focused, and I'd like to introduce the members of the team that have come to be with you tonight. My name is Ann Racine, and I am the Vice President of Development and Community Relations for Health Alliance. And I have been really around the Fitchburg and Leominster community my entire life. Here you go. I began to work for Health Alliance about 16 years, what was then called Leominster Hospital, and about 6 years ago, with the consolidation of services, I went up to the Burbank campus, and that's where I am based right now. Dave Duncan, who is the VP of Engineering and Facilities, is probably very well known to you, as he has been working on our buildings at both campuses for a great deal of time. Eldon Munson is the director of the Spalding Rehab Unit on our campus, and recently has been named the administrator of Burbank. And Mary Newcomb is somebody who certainly is familiar to you. Mary has been in this community all her life as well, and she is the director of Cancer Care Services for Health Alliance. What we'd like to do tonight is basically have Dave walk us through the master plan and then address the cancer center itself. We'd all like to chime in, although Dave has the bulk of the presentation because so much of it relates to buildings and the facility. But we'd also like to have you interject questions as they occur to you, as you see things. There really is a lot of data, and we want to have a very friendly, open discussion. We're pretty excited about the plan that we're bringing you tonight, so we'd like to have some feedback and some questions as we go along. Is that okay? Maybe for 20, 30 minutes?
That'll be fine.
Okay. Dave.
Well, thank you. Council President, what I've done right now is set the screen up here. Would you mind if everybody came around this way? It's not all on the overhead. And what I wanted to do tonight is, Ralph, a month or so ago, asked Ann to pull together a team to come and give an update on the master plan, because early spring, Health Alliance began a new facilities master plan for the Burbank campus. And the reason why we did that was when Leominster and Burbank merged, there was a master plan, and that was 6 years ago. And basically what that master plan said was the inpatient services were going to consolidate at Leominster, and Burbank was going to be developed as a state-of-the-art ambulatory care center. Well, as everybody's well aware, a lot of the inpatient is consolidated to Leominster. Leominster's replacing a lot of its facilities over there, and we said we needed to do a new master plan for the Burbank campus because time has passed, and we basically completed what our initial plan said. The new CEO, John Robbins, said, as part of our original merging master plan was we were going to make Burbank campus a state-of-the-art ambulatory care center, and we had some rough plans of how we were going to do that, and there was really no detail or meat behind that. And now that we were well into this consolidation, pulling out of all the bugs that we needed to work out, we needed to get forward in some planning on how we were going to go forward with the Burbank campus. Now, the master plan, people in the audience typically know a master plan as just related to buildings. Actually, this master plan was about 75% program and what do we need to do and provide services, and about 25% building. We hired a company called the Bristol Group, and they're a local firm out of Boston. We touch base with firms throughout New England, and what our main goal was there's all kinds of hospitals merging together, all kinds of sharing communities that have merged together and tried to make one site. And we wanted someone that had some experience in dealing with mergers and find out what worked and what didn't work, and how let's learn from some other errors and mistakes throughout the country and try to do a better job. So we hired the Bristol Group, and they hired as a consultant to them an architectural firm called Stephan & Bradley, a brand new architectural firm that hasn't had any look-see in this campus. So early in the spring, what they did was, and again, John Robbins, our CEO, said, this master plan is going to look at program, what does this community need, how do we convert and make Burbank the state-of-the-art ambulatory care center. There was 50 or 60 meetings from physicians to patients, all the department managers, all the board of trustees, the medical executive committee of the doctors, many of the counselors and city filers were invited to a meeting, all the social service agencies, and many of the other people, Northern Healthcare Coalition, and what they were asked was, what do you see for needs in the community for healthcare? What are the needs that you guys are dealing with every single day? And they also looked at statistics, they took populations, they found out how many people were going to Neshoba, how many people were going to Henry Haywood, how many people were going to Fitchburg, how many were going to Leominster, how many were going to UMass. And basically when everything got boiled down, the report said a lot of great things for the Burbank campus and the Fitchburg and Northern community. It said that Health Alliance and the community need Burbank campus, and they need Burbank campus to grow and thrive. The community, the public, need the Burbank campus. We can't support all our health care just out of the Leominster campus. And then they looked at programs, and they made a lot of recommendations on the areas of where we need to improve, where we need to cut back on, etc. So I'm going to go to the overheads now, and I don't have the best scenario, basically, because I'm real close here, but I will do an awful lot of explaining. So when all the reports came back and said, Leominster can't handle all this, we need more outpatient point of care, we need more OB women's health programs, we need more mammo, bone densitometry, etc. When we got into the facilities look options, there was basically 3 options. And the top line outlines the 3 options. And option 1 was asking us, do we want to keep any inpatients on the Burbank campus? And if we do, there's a way to do it of renovating the existing buildings, and that's the A option. It says no demo. And the B option says demo a lot of the existing buildings and build some new stuff. And the A and B are consistent through all the options, so we'll focus on the top line. Do we want to keep inpatients on the Burbank campus? And what we have right now is we have the behavioral medicine unit, we have the rehab unit, and we have some beds internal to the hospital, some observation, med-surg type beds. The other option 2 said, do we try to go what the initial intent of the hospital merger was, to try to continue to consolidate all the inpatient on the Leominster campus and make Burbank just an ambulatory care center. And one of the easy things we could do is easily move rehab to the Leominster campus, but the behavioral medicine unit was a more difficult step. So that was option 2. And again, there's an A and a B. We could do that by renovating all the existing buildings or by demo the existing buildings and build some new buildings. And option 3 said, let's take all the inpatient services from the Burbank campus, consolidate the remaining portions over to Leominster, and just make Burbank an ambulatory care center. Well, through all the analysis and through the board, we selected, and the board selected option 1. Okay? So that option was a rehab unit was going to stay on the Burbank campus, the mental health unit was going to stay on the Burbank campus, and we were going to build around the ambulatory components. The cancer care center was going to maintain on the Burbank campus. We were going to bring more physicians onto the Burbank campus. We need to bring a nucleus of physicians to the Burbank campus for several reasons. One of the main reasons is it brings more patients to the campus, which uses our support services. It uses the lab, it uses the x-ray, it uses the rehab, which helps keep that campus striving. So we selected option 1, which was good news. And I'm going to go into more detail. And then we looked at heavily, do we go and try to renovate the Bullock building? Do we try to renovate the west building? Do we try to renovate the east building? And do what we need to do over there, put the cancer care center in the older buildings, put the physician office in the older buildings. But there's plenty of square footage. Currently, right now, there's around 400,000 square feet of buildings around the hospital. The Simmons building is a little more than 100 square feet. The Bullock building is a little more than 100 square feet. And then all the buildings in the back, the old wood frame buildings, the original hospital is around 100,000 square feet. And then not including the Highlands, there's another 100,000 square feet. So what we said, oh, my watch is, was we looked at the cost comparison to renovating the Bullock building, the east building, the west building, compared to building a new building. And it relatively came out just about even. But what it was you needed to use a lot more square footage in the old building to meet our needs. And the perfect example is the Bullock building is around a little more than 100,000 square feet. And it's around 25,000 square foot per floor. And the Bullock building is a long T, it's around 300 feet long. And then it has a T about 100 foot long, and it's only a 45-foot width. And we have an 8-foot or a 10-foot corridor, so it doesn't leave much room. And in order for us to convert that to physician office buildings, if I were to build a brand new building and put new physicians into that, the rule of thumb is around 1,000 square feet per doctor. And I lose about 30% efficiency by using the existing building. So for me to put doctors into the Bullock building, for every doctor I need to use around 1,300 square feet. And when you do the economic model and they've got to pay rent, et cetera, the rent has to be a lot less because you have them in less efficient space. And we had some major costs to bring buildings up to code. So we selected option 1B. The main reasons why we selected option 1B was it demolished the old buildings because when we again took a snapshot of what was it going to take to bring the older buildings up to code, it's just about the same cost as what it would cost to tear them down and build a new building. It opens up the campus for future site development, allows us to put a new building there and create a new cancer care center, and allows us to bring parking closer to the Simmons building. And it also allows us, the master plan looked at it very briefly, what other options does that campus have? There's 60 acres out there, and I'll get into a little bit of that because it opens up some other options. And the most important one was that it located a cancer care center in a new building, which provided a lot of flexibility to the campus by allowing us to maintain rehab and inpatient site. The issue is, and Mike is here and he knows this, I have a rehab service which is technically defined as hospital use in the Bullock building. The Bullock building was built a long time ago, and it doesn't meet today's codes of institutional use. And for me to be able to do any work in that building that's substantial, like renovate one big floor to put physician's office in it, or to take one floor and put a cancer care center, it now kicks us off, and I've got to bring the whole building up to speed and bring it into institutional use. So we were now going to do a $25,000 renovation project, and I was going to incur some major costs of a 100,000 square foot building. So, and the other issue was we want to get the rehab unit out of the Bullock building and put it in the Simmons building, where the majority of our hospital use is, okay? And if we didn't build a new building for the cancer care center, we went through a whole design locating the cancer care center in the Simmons building. We have a Simmons, a Simons, we have more different messes. And if I put the cancer care center in there, it obligated me to fairly quickly put in the neighborhood of $8 to $10 million into the Bullock building, into infrastructure issues, into sprinkler systems, into ventilation systems, etc. And it really reduced the flexibility of keeping inpatients on the Burbank campus. So we decided to put a cancer care center in a new building. Any questions so far? Yes.
Yeah, when you talk about demolition, what is the difference between what you did in Leominster and what you want to do in Fitchburg? In Leominster, you built around the old buildings. And why isn't it you can't do that in Fitchburg?
We actually are. We're going to build around the Simmons old building. And
Why can't you build around the Bullock? It's not as old as some of the buildings in Leominster Hospital.
I know that, but over periods of time, there was a lot of money put into the Leominster Hospital buildings, and they have the sprinkler systems and the asbestos.
That was your first mistake.
Right, right. But what we are doing here is very similar to what we're doing at Leominster. We said, you know what, instead of trying to put some of the new state-of-the-art services in older buildings, let's build something new, and it'll be better off.
Dave, I think one of the analogies that someone used is, at what point do you take your used car and decide that you're better off stopping the repairs on that and going to something that is new? And I know the numbers have really borne it out that if we have equal amounts of money being spent into the old to retrofit it or into the new, we're way ahead of the game to have the new. We at Health Alliance are willing to make this investment of capital into those buildings so that we'll have a fresh start going forward. The other thing is, Mr. Burke, I don't think that when we say demolition, we don't mean that we're going to start that in the year 2000. That is way off, and that this is a master plan for the future. We don't want to spend our money right now taking things down because we need that money to build things. So we're trying to give you the whole global look today of what we're thinking of over the next 10 years and more. So you will not see demolition immediately at the Burbank campus.
The option 1B was not the least expensive option, by no means. The option 1B is going to have a price tag of $26 to $30 million of new construction. So when the finance people got a hold of X amount of millions of dollars in older buildings and similar millions of dollars, it was the finance people who were saying, we as a system are much better off trying to put the new services, the cancer care services, physician offices into new buildings. What we did was...
Can I ask a question?
Yes.
While we're on the Bullock building?
Yes.
It's my understanding the Bullock building contains the operating rooms,
Yes.
and so you'll be demoing the operating rooms. Is there a provision in this new building that you're talking about for full surgical operating rooms?
No, it was part of the original plan to consolidate the acute care services onto the Leominster campus. that includes the consolidation of surgery. And the reason is running 2 surgery departments. And you really want to run one surgery department that people can come out of surgery and walk out the door and go home, and come out of surgery and go into an inpatient
There are
bed.
some of us who probably feel that once you remove the remaining remnants of what we used to have as a hospital up on the hill, namely the surgical suites, the operating rooms, then you forever say goodbye to any possibility in the future of that becoming a hospital again. Is that true or not?
That's kind of strong. No, I don't think that's true, because you can do anything today. Healthcare is changing so fast where you're going to see surgery in physician offices, and some of them are doing it now. And one of the things we're going to build is new physician offices, and those new physician offices will be able to handle some of the today's and the future procedures. Also, on the 3rd floor of the Simmons building is the day surgery area, and that's maintaining there. Why don't I tell you about the plan of demo, because as Ann explained, to do the big project, we're locating a new building so we don't have to do any demo right away. And the last building to come down in our plan right now would be the Bullock. And that's in year 6 or 7 through 10. And a lot changes. And that was the reason why we moved this plan, because if healthcare changes, the Bullock building, and we had a need, could be revitalized. So it's the last building to come down. So we had a $26 to $30 million project, and no, we can't afford $26 to $30 million right away. So we broke it into 4 phases. Phase 1, let me orientate people to this chart. What it is just a basic stack chart, and this is saying this is the west wing, and this is what's in the west wing. It's some housekeeping, some print shop, etc. In the north wing, and the north is in the back where the cafeteria is, and we have a north wing, a northwest wing, a north wing, and a northeast wing. There's like 3 buildings back there. We all define it in the north building. We have the mobile MRI, we have some of the medical records, and the upper 2 floors are vacant. And in the Bullock building, in the basement, we have some storage, and on the 1st floor, we have some pharmacy and registration, and on the 2nd floor is the rehab unit, and currently right now the operating rooms are used very little. The majority of the operating rooms are used, it's in the Simmons wing. And on the 4th floor is the UMass Family Practice, and on the 5th floor we have the Systems, Human Resources Department, etc. And in the Simmons building, it shows what we have in the Simmons building. There's some mechanical space in the lower level. There on the 1st floor is the emergency room and physical therapy and radiology and lab. On the 1st floor is where we have some sleep centers and some dialysis, and that's where we're thinking about putting the cancer care center. It's basically, and oncology is there. And on the 2nd floor, we have our inpatient psych unit, and we're doing a lot of outpatient psych that's growing. And on the 3rd floor in the future is where the surgery area, we still called it vacant. And what we called was a new building, let's slide this over, and that's the blue shade. And on the lower level, it has the ability to be a 5-story building. And the lower level would be a 13,000 square foot footprint, and that would be for future hospital support spaces that are mixed in the remaining areas, the medical records, the administrative services, the shipping and receiving, the stock room, the supplies room. And on the 1st floor, which is the same level as the Bullock front lobby right now, would be a 21,000 square foot footprint. Some of it would be over basement and some of it would be on grade. That would be the new cancer care center. Okay, and that would be what we're defining as phase 1 right now. And that building would be designed structurally, mechanically, elevators, etc., to be able to take 3 more stories.
Who's the emergency room?
Emergency room maintains in the Simmons wing. We put in excess of $2 million into the ground floor of the Simmons wing, and the emergency room is part of that. So phase one goes from basically now out 2 years, and it's saying we're going to put about $9 million worth of new construction up there. Phase two goes from year 2 through 4, and that's another $11.5 million worth of construction. And what that would be is, again, the shaded blue. And that's identified as more physician offices and a potential of a community health center. And that would go on top of the cancer care center.
Did you say community center?
Community center.
Could you say that slower again about the community center?
For many years now, there's been a federal grant put in for funding, asking for federal government funding, and it was in partnership with Health Alliance and UMass to create a community health center.
It was actually the initiative of the Fitchburg Safe and Healthy Neighborhood
Yes.
with a prime office of that.
And when we went to the Department of Public Health to get some of our determination of needs to do the project at Leominster and to do the project up at Fitchburg, and then again to merge with UMass Memorial, we committed that if the community health center ultimately got located on the Burbank campus, that we would commit to $750,000 worth of funding in order to put into the facilities to help start that program off.
For the first year,
Yes,
but not after that.
right. I don't know.
I just want to be sure I have the same story that I heard before.
Yes.
So, thank you.
And Annie, I think you know that sometimes that's very, very close to getting funding, and then all of a sudden it misses a funding cycle, and then they wait another time. And it was actually about a month ago that we heard it was on the final cut sheet of the federal budget, and we really haven't heard any more. So what we've done in our master plan is allocated space, if that ever goes forward, that we would be able to provide space for that. Okay?
Okay, I've got a question.
Yes.
Who would run that health center?
It would,
Be a collaboration between the agencies that Dave mentioned. We would hire, not we, the group, the steering committee of the Fitchburg Safe and Healthy Neighborhood in collaboration with UMass and Health Alliance would hire a person to run it, an executive director.
the latest discussions are, currently we have the Fitchburg Family Practice.
Yes.
The Fitchburg Family Practice serves similar patients at the Community Health Center.
They serve all of the population you're talking about.
Right now, the latest application that went in was that the Fitchburg Family Practice would merge in with the Community Health Center, and they would make one large Community Health Center with a residency practice.
So we
So
wouldn't be duplicating the service.
you would not be duplicating the services. The next phase, which would be phase 3, which now says we occupy the lower level of the new building. The remaining west wing and north wing would now be vacant, and we would be able to begin demolishing these back buildings. And that's year 4 through 6. And then yes.
Simple question. On the charts, what does the tan and gray areas represent? I know blue is new development. What are those colors?
Some renovations and modifications, and what that's saying is, because we're going to keep the Fitchburg, the rehab unit, the inpatient unit now on the Burbank campus, we needed to modify our existing radiology department in order to do fluoroscopies, because there's some practices now that the inpatients that are located on the Burbank campus have to be transferred over to Leominster, and their radiology department have a test done that takes an hour and then come back as an inpatient. And as we met with all the physicians, and there's about 16 physicians currently right now that have committed that they will come to this new building on this campus, they said fluoroscopy is becoming also an outpatient procedure, and our patients that come into our doctor's office, we want to be able to say, go down and get an x-ray, go down and get lab work, go down to physical therapy, go in and get a fluoroscopy. So it's about a $700,000 machine. So this color represents, we would now have to modify the radiology department in order to install that machine. And on upper level, this brownish, is saying now we would take the Simmons building, the first floor, because the cancer care center is open. And some of the other good news that I haven't mentioned was last week, we consolidated the Leominster's oncology services onto the Burbank campus. So now, for some time, we've been running 2 oncology departments. And we consolidated Leominster's onto the Burbank campus. It's on Simmons 1 as a temporary situation, and all we did was just take some more rooms. So the patients are all coming over to Fitchburg, and Mary has a flyer here that they have an open house for everybody, and that is when?
We're going to have an open house on Tuesday, December 21st, from 2 to 6 p.m. We would like everybody to come and meet our consolidated staff. We will also have representatives of our community advisory group will be there also to help answer questions. So please, I will hand out the flyers, and please help us publicize this.
So what this is saying, this brownish is saying, we would renovate Simmons 1 to now be able to take the rehab that's in the Bullock building and put it in Simmons 1. And this whole Simmons building is under a code called institutional, which is what's under the category of hospital. It's fully sprinkled, it has the appropriate ventilation system, but we're still in the neighborhood of a $2.5 million renovation project of Simmons 1 in order to put rehab in there.
Okay. And up to this point, we've seen no demolition, right? Simply...
Up to this point, you wouldn't see any demolitions.
Okay. Thanks.
Okay. And then on the last phase, which on this schedule, which is year 6 through 8, is the beginning of the demolition of the Bullock building, right? So we really have quite some time, and if we look at how healthcare has changed in 2 years and 4 years, and this Balanced Budget Act, things got to change. President election, election is coming up. So the Bullock building has been isolated as the last building to come down. So if there's a need, if all of the baby boomers and all the studies are starting to say, we shrunk beds, we've taken beds out, we've consolidated hospitals. They're just starting to come out with data that in 6, 8, 10, 12 years, we're not going to have enough beds, right? Because now all the baby boomers are going to be into their 60s and early 70s, and they're not going to be able to stay in the assisted living, except they're going to need to go out. So that's that's really in our plan.
That's what my concern was, that, he's got to make plans to take out the only surgical, major surgical means that you have, and what does that leave for the future? Are you really, truly planning well for the future? I mean, that comes to mind.
It's a good point, and I think what you can see now is we don't have all those answers, and I think we're committed to relook at our master plan at a 2- and 3-year interval instead of waiting 4 years and update it. The main gist around this master plan was we need to get some more volume, we need to get some more vitality out of the Burbank campus. We do a substantial investment into it right now in order to make that all pay off. And most importantly, to make it convenient for our patients in the northern tier, we needed to develop the next step, and the next step was this. And an integral part of that is getting physicians on this campus. So
I might interject, Dave. We've successfully hired a new psychiatrist to head the behavioral health area, Dr. John Aney. We've successfully recruited a physiatrist for our service on rehab, Dr. Robert Dieters, and the emergency department is well led by Dr. Jonathan Jones for the consolidated Leominster and Burbank emergency rooms, and he spends a good deal of his time on the Burbank campus. So physicians and program development are a very important part of what we're trying to do here, and we've begun with the base of some very excellent leadership that are with us every day now.
With Eldon, you bring up a good point. Was when the merger first happened, We had physicians leaving, we had patients leaving, we had employees leaving. We didn't want to put up with all the baloney. I had a doctor's office building that went from 100% occupied to 50% occupied on the Burbank campus. And right now, the little physician office building, it's a 25,000 square foot building. I have 1,600 square feet vacant. And just 2 years ago, I had 10,000 square foot vacant. So physicians are moving in, and those are the physicians that are saying, build me the new building, because we basically moved them in. We put a coat of paint on the office, put a new carpet down, and they're utilizing it. They want to get into a new building. And with there's been some group practices joined, and Ray Waleko has created a large physician practice, and it's part of the UMass Memorial System. And they're committed on bringing specialists up, and the new physician office building would have some flexible space. So some days there'd be cardiologists, some days there'd be pediatricians, some day there'd be a pediatrician psychologist, one day there'd be a pediatrician cardiologist coming up, so that the physicians would know every third Thursday or 2 Thursdays a month there's a pediatric cardiologist coming up, or there's a specialized whatever coming up from UMass. So some of the physician office space would be allocated to flexibility of specialty practices coming in. You know, some of the ideas that they're talking about in today's environment is, as part of this new physician office building, we ought to be providing a small little daycare. When the Bristol group went to all the doctors, they said, there's more mothers come in with the 1 or 2 kids, and you know what? They got to go in and have a mammogram. And then we find something, and we have to go in and talk to them for a while, and now it's a 35-minute process that the 2 little kids are out in the waiting area, and now my nurses are running around. So concept-wise was in the doctor's office building was a little daycare in there, funded by all the physicians. You come in, drop the kids off, it's a little playroom, you go in, you see your doctor, you have your check, you have your ultrasound, you go back 40 minutes later, 30 minutes later, an hour and a half minute later, okay, let's go. Make it convenient. And the more convenient we make it, the more customer-friendly people are going to come there. This was a site plan.
I have a question.
Yes.
The man over there said that a new psychiatrist was coming into the science unit up there.
Yes.
Could you tell me if the people who run it have allowed mass health to be taken at that campus at this time?
Annie, that is one of our top priorities from an administrative point of view, and that doctor's #1 task is to get the license from Mass Health. We applied for it. You know how the state works. It didn't get given to us, and we are actively trying to get that back.
When the unit was opened, you had it,
Yes.
and you didn't reapply the first year. Now it's 3 years later.
Am I correct in my assumption? Because I work with the mentally ill, so I do know. When anybody from my group goes, they go to Worcester or Marlborough, they can't even go into that unit because you do not allow, or because nobody asked for the contract with Mass Health. So when you first put that psych unit up, it was supposed to be for the people of Fitchburg and the surrounding towns. People of Fitchburg who are in Mass Health, who are poor, cannot go into that right now. Am I correct?
Yes, you're correct, and we know that. And you need to be, the only one modification is when our cycle was due, we applied. And we gave it all guns, and we had all the tours, and we got a letter saying another hospital got it, or because Henry Haywood had it, it was close enough, and another one was Worcester. And what it is, it's a 2-year cycle. And we have reapplied again, and it's beyond that 2-year, and the state is saying they don't know what they're going to do with this licensing issue, and what hopefully is going to go away, and what we're anticipating is Mass Health patients will not only have to go to Hospital A, Hospital B, Hospital E, Hospital H, they're going to be able to go to all. And if they don't, UMass is right now, one of the advantages of UMass, or we're going to find out one of the advantages, is they're putting all the pressure, and the political pressure, and the big system pressure on Burbank needs that Mass Health. So that's top on our radar screen. And we know that, and we're trying to get it back.
it'll make a big difference. As we interviewed a lot of the groups, the master plan came out loud and clear that there was not enough mass health services around here, from dental services all the way to psych. And this was identified in the physician office building. We have a space allocated for mass health dentists. We need to recruit a mass health dentist because Annie's group was saying, they got to go to Waltham. It's the closest one around that's taking new patients today. So, the site plan, to orientate people, this is the big hill that comes up. This is the emergency room. As you drive up to the Bullet building, there's a grassy knoll. Here's where the new physician cancer care center building would go. And what we looked at was, we're looking at some other development uses for what we call a Crocker estate property. Looking as we go over past the Highlands, there's a big chunk of space over here, parcel C, that has some potential reuses. And if the new physician office building goes in, the physicians would come out of this building, and it opens up future development for this section of the site. And then long-term is the west building, the north building, the east building. And if the Bullet building comes down, we would wrap the parking right around here. So as you drive up, you're now parking all the way around the Simmons building, be able to have a walk-in entrance from the first floor right into the rehab unit. The emergency room entrance would be down at this level. All the testing would be down at this level. This new building would be connected into the Simmons building. So if you're coming in as a patient, a cancer patient, you need lab work, you need x-ray work, you need nuclear medicine work, you need whatever, go down a corridor, you're into the Simmons building. If you're a physician, you'd be the top stories on here, you go down an elevator, you need to get some lab work, you need to check to see how things are healing, you need to go to get physical therapy, it'd be all integrated right into the campus.
Just remember that the Crocker property down bottom right was not included in the medical district overlay.
Yes, I know.
And that's zone residential, so you shouldn't include that in your plan. Who's telling you to include that in your plan?
It might be in our plan to let it be developed as residential. It's not in the plan as related to the hospital.
What does it say?
It just says Crocker property, it's 14.2 acres, zone residential.
Well, it's shaded, and what's the shading over there say?
It just says development option number 1, Crocker property, parcel A.
What's option 1?
It's just that there's an option for another use of that property. Residential. Let me check my presentation cheat sheet here, make sure I wanted to address.
David, can I ask a question?
Yes.
I see your master plan. How does the emergency room fit into this master plan?
Good point. We requested an extension to the emergency room satellite waiver for 2 more years from the DPH. And we received our letter on November 30th, and we just got it, and we got a 2-year extension for the emergency room. So right now, we have the ability to maintain the emergency room per the DPH licenses for another 2 years. And they were very happy with the services and the results so far.
You ever think that will ever come back because of all your master plans here to become a full-fledged emergency room down the road again? In light of the fact that the emergency room you got it understood for now?
That's a tough question. I see in what this plan addressed is it would maintain its existing state as it is right now as a satellite emergency room. And we really need to look in 2-year intervals. Things change so fast. So right now we don't see anything changing with that status. One other component that I saw on my sheet, our goal was to move as many outpatient services to the Burbank campus, and we are now also about a month up and running of a new bone densitometry, and that's the first bone densitometry unit that's in Health Alliance. We had some mobile, a guy would pull up with a van and do bone densitometry. We have a brand-new state-of-the-art bone densitometry, and it's the only one in the system. So they're trying to put more and more new technology, new state-of-the-art stuff on the Burbank campus. Schedule for the Cancer Care Center. We did a whole design on the Simmons building, and we're going to be able to utilize a lot of that design in the new building. And we expect to begin the new design in January, and hopefully be able to begin construction of that building in mid-year 2000, sometime in that summerish time frame. And right now it's a 12 to 14-month construction time. We are in the process of doing all the DPH paperwork to relocate the linear accelerator license from Worcester up to Fitchburg. We expect the hospital board to vote on the final funding sometime in winter of 2000, hopefully in the month of February. And once that funding is approved, an order for the new linear accelerator will be placed. And that's just about a $3 million piece of equipment, and they're not hanging around on a shelf, and they take about 12 months to build them. So if we can do our timing right, the linear accelerator would come online very close to when we'd be able to open up our new regional cancer care center. We are...
Good news is that we have 2 of that $3 million. You may have read in the paper that we had received $1 million through Congressman Oliver's intervention, and we have received a second $1 million. So we're pretty excited about that.
And are there
Yep.
no strings attached to that funding?
The only thing was something about the name. There was nothing.
Pardon me?
There was something about the name, but that was it. Do you have a specific question?
No.
I think what
The concern is anytime the government dollars come your way, there's strings attached. So what
Yeah, there is some. The string attaches, it only can be used for the cancer care center. And it has to be used in the Fitchburg campus, and one of them said they wanted to have the ability in the naming of it.
Yeah,
I wasn't getting
something to call it research center, and that's not appropriate because we're not going to be a research center, so.
The Olver Center.
That was the...
So there's no strings attached, but it can't be used for tearing down the building, or it can't be used for building the doctor's office. It has to be used towards the cancer and the radiation therapy portion of the cancer center.
Okay. Can I ask another question?
Yes.
What surgical, if any, will be left at the Burbank when you're finished all these plans? What I'm interested because I just had my foot done up there. It was wonderful. They were so good. They were so loving. It was beautiful, professional people up there. And I just love the idea that I found a parking place and I was able to get in and out without being killed. It was lovely. And I was wondering, what do you plan, or if anything, for any surgical needs?
Right now, the surgical needs are, or the surgical plans are, as the new Lemonster's operating room opens, all surgery will be consolidated there. Right now, we're doing 2 days or 3 days a week on the Burbank campus, and that's been the plan for a while.
That doesn't mean it's right, though.
I know that.
How about when you get the cancer sent up and you have to have a biopsy done, which we all know if you have cancer, you have to have several times you have to have biopsy. Will you have those provisions within the cancer units to have that done?
No plans right now. But as new physicians go in, biopsies are happening in physician offices right now. So, and before we know it, things are going to be removed in physician offices. And I don't know all the clinical terms, but as we develop this new physician office building, we get the appropriate doctor in that building. He could be doing the biopsies right there.
In the 2 years that you got the extension for, which I'm very happy you got, and you open up your emergency room in Leominster, will you be closing the satellite emergency room at the Burbank campuses?
That's a tough question, and I gotta say, and every day the hospital is struggling, mostly because of the Balanced Budget Act of 1997, and there's a 5-year plan that is reducing the revenue that the hospital gets for the exact same service. And basically what that says is, if nothing changed, in Health Alliance, and we saw the exact same amount of inpatients, the exact same amount of outpatients, we would receive how many less $1 million in funding this year?
Well,
or revenue?
last year it was 500,000. Going forward, it's $1.5 million, and it will go on and on unless there are some changes.
So this year, if nothing changes, there's $1.5 million less we're going to be paid for the exact same services. So Annie, every department in Health Alliance is looked at and scrutinized and say, what are we going to do? Is there a more efficient way to do that? And that doesn't preclude the emergency room, but the emergency room, as John Robbins has said, is a very complex situation, and you just don't shut that down. It has too many integral parts to the whole healthcare on the Burbank campus. It relates to the mental health service, it relates to the rehab services, and I think the decision for the board to go with option A that says the inpatient is going to stay on that campus really makes it much more difficult to modify in emergency room services. But everything is looked at, and there's no plans at this point to change it.
Yeah, I think sometimes, people could possibly feel that we're hedging or that we're not telling the whole story. And truly, it's a very dynamic, challenging healthcare environment that we're in. And if you do have family in other parts of the country, they're probably telling you the same thing that you're hearing locally. If we hadn't brought these two hospitals together 7 years ago, if you can imagine it, 7 years ago when we merged, we would not be having healthcare services here right now, and that's a fact because both those hospitals were not going to be able to survive. And we're trying to put together a program that takes care of everybody from the time of birth to the time of death, maybe not in the same way of the past that you go into one building and that's where it all happens, but we're trying to address the needs regionally so that you can get this service locally. It's still a better option, I think, for most of us to be able to get a test at Burbank or at Leominster than to go to Worcester or Boston. Most of us, that fits better into our lifestyles, into our time schedules and whatnot. And that's, we're talking buildings, but Dave started his presentation by saying 75% of what we did was based on services and programs that help our patients. There's no point being in this business if we're not concerned about how the patients are getting their care. And it may not be like it was 10 years ago, and it's certainly 10 years from now, we would not have the same conversation. I don't know what the conversation will be, but it's a very dynamic environment that we're in, and we have to constantly adapt and adapt and adapt. And I know then it makes it sound fuzzy, and there's nothing we're holding back. Dr. Robbins himself couldn't be here tonight, but his message is clear. He has integrity. He does not want to lie to people. There's no way he's going to stand in front of the city council and tell you anything that is erroneous. However, he can't tell you what it's going to look like 2 or 3 years from now. We don't have that information yet. Paul?
But you know what Leominster ER is going to look like.
It's going to be, right, it's going to be.
Why can't you make the same commitment to Fitchburg ER? Now, you mentioned we've got to look at the ER in 2-year intervals. Well, you don't look at the Leominster ER in 2-year intervals. You have a whole huge population of people here that you're not dealing with in the emergency services. You're not making the same commitment to our emergency services as you are in Leominster, which has about the same kind of population base if you draw circles and everything else. This is the problem. You can certainly commit to Leominster ER, but now when the tough question comes, when they say, what about Burbank ER? You say, well, we can't make any promises there. Well, make some promises there, for goodness sakes. I mean, I think that's where the frustration is. And you're talking about a lot of neat things here with the cancer center, and with, I don't understand oscopy, the thing.
Neither do I. Fluoroscopy.
Those are all neat things. But you know, when it comes down to the basics, when someone's needs that emergency room, they've got to somehow make their way to Leominster. All ALS service has got to make its way to Leominster. When they're within minutes of this facility, there is something grossly wrong there. And that commitment is not being made to the Burbank campus.
Why does it take, and testing services aren't equal either. Why does it take 3 months for a mammogram at Burbank, and you can get almost walk-in service in the Leominster campus?
That's
What?
really, Paul, that one is not true. I hate to say it.
But they're not equal.
Well, let's put it this way. It's not equal because we have more night hours at Burbank than we do at Leominster. Truly. That's a service that the need is far surpasses our ability to keep up with it. I mean, you cannot get an appointment in a week.
Okay, so there's one thing I didn't say correct.
All right.
The
but
rest is
we hear what
correct.
you're saying.
The rest is correct, and we have to say it loudly enough. And I know you don't want to hear this. You want to come and give a good presentation and leave in the Christmas spirit and everybody be happy. But, you know, we have folks that tell us this all the time. As elected officials, we have people crying to us for services up there on the Hill. And you're not making the same commitments. There's a rumor right now that you're going to shut down the 11 to 7 shift in the ER. I don't know how true it is, and I don't know how close to reality it's going to become, but it sounds like that's the kind of direction it will head in.
I think
These are the frustrations.
Yeah. We understand your frustrations. We are trying as an entire system to really respond to what everybody, nobody more than I, being in this position, would want everybody to be happy with what we have for services. I still think there's room for us to do a tremendous job at the Burbank campus to bring millions of dollars into this region. Our spin-off services, the jobs, the vitality of the region, I think, is going to be well served by the Burbank campus. It may not be exactly what every single person is looking for, but it certainly is a very vital, invigorating service that we're offering. And I think, Paul, we need your support as city councilors. We need you to help us develop all of these initiatives so that we have the support that we need going forward to get through whatever obstacles will be in our way. You know, I think we're thinking big, and we hope that you're thinking big, too.
And Paul, the volume is starting to change. If you look over the last 12 months, the ED volume on the Burbank campus is increasing. Not at any record pace, but month to month, there is more patients seeing that.
So I think the rumor...
That's a good sign.
Yeah.
And we think the more that we're doing up there, the more people are going to believe again and then use it.
So I think, Paul, the rumor came from the fact that when asked the question that Annie asked Dave, someone asked on a radio program, and Dr. Robbins answered it as truthfully as he could. He said everything that he could say on that day about the situation, and the situation was we had less patients coming in the door than we had people there to serve them. And that's not an easy situation. Did he say, therefore, we're closing it down? No. So, I mean, I think he just honestly said, this is the predicament. And then people jump to the next conclusion that, therefore, that's the end of it. But one of the issues is that as long as we have patients on that campus who are sleeping there, meaning our mental health patients are overnight as well as our rehab people, we have to have physician coverage. So do you want physician coverage in the ED as well as, you know, serving the rest of the floors? So it's a much more complicated thing than just, oh, shut it down and that's the end of it. And I'm sorry.
I'll provide a nice segue on the question that I had. As you consolidate services, especially as you had said, the ambulatory ones at the Burbank campus, why isn't mammography consolidated at Burbank? It seems like you have two separate ones going on here.
We can have, because mammography is part of a radiology department, and there's a radiology department at both campuses, and that was a decision that there's no way we can consolidate and make one radiology department, because it's what the physicians need and what the patients need. We currently, when we renovated and built the new Simmons ground floor, we put provisions in for 2 mammogram machines. We have 1 machine running right now. We could not get a tech. One of our backups had nothing to do with machine time or scheduling time. You need to be a certified technician, pass a test to do mammograms. And the hospital is no different than the other business that everybody works in. People jump ship and go to another place and et cetera. And we have so many staff to cover so many hours. And we did our own training process, right? We were searching, we were looking all over the place. We heard that when Athol was maybe going to close, our director of radiology went up to Athol, spoke to all the mammos, and said, I got a job for you. I'll give you whatever hours you want. This is what I'll pay you, whatever. They didn't come down. So what they ended up doing was taking some x-ray techs, sending them to school to get trained and certified in mammo. And we are on the final phase of that. And then they will be able to do mammograms, we'll be able to do more schedule. As soon as we have those techs, we'll buy another machine and be running 2 machines because it's easy to get x-ray techs. So it's really a technical staff issue, not a machine issue.
Okay. The other question, I had a couple more questions. How confident is Health Alliance in recovering the customers and its market share in the area that I think it's lost to Henry Hayward, Neshoba, and some of the other hospitals?
They're starting to come back, and this is a major initiative to get more of them back. The majority of the customers lose due to physician satisfaction. Another poor thing that happened is we went several years without recruiting a new physician. I don't know if anybody heard, but really what Eldon said was really the most important thing. Doctors are now starting to say, coming out of medical school, are looking, hey, I want to go make my home in Health Alliance, where we were in turmoil for the year, and we went several years without getting one new doc, and they're coming now. We've had 6 or 7 new docs come into the system. So I think as that happens, positive feelings start coming back, and our statistics are starting to show it's starting to come back.
Okay. The other point I just wanted to make was, I couldn't have said it better than Councilor Fontaine as far as the importance of the emergency room. But you know, the fact that there are less patients than doctors at the emergency room at Burbank is Health Alliance's fault.
Yeah.
It's not a logistics problem. And I brought this up to Dr. Robbins when we met at Leominster, where we were talking about the project going on. I also brought it up when we met with the Bristol group. Annie, I think you were at that meeting?
Yes.
And I can sit at home and I can turn on my scan. And every ambulance, I don't care if it's coming from the north end of town, it's going to Leominster. And these are not ALS. These are simple BLS calls.
Yeah.
Very seldom do I hear one get sent to Burbank. And when I said it to Dr. Robbins, it's your responsibility. You have to get a hold of your doctors, put a leash on them or something and say, hey, look, let's get real here. If it calls for it to go there. And basically the response at that time was, everybody wants to cover their own butt, and that's why they send them to Leominster. In the extreme case that it might be an ALS problem down the road. And we're working on educating our physicians and changing that. And from the looks of it, it doesn't seem to be changing, or it's changing very slowly.
It is changing, and I got to tell you, Ralph, Dr. Robbins has done exactly what he said. He's been at the Med-Exec committee and telling them now, don't always just take the easy route out. We need more volume over there. He goes to the medical quarterly staff meetings, and one of the important things about Dr. Robbins is he's a physician, and they can listen to him. So he has been preaching to the docs. Come on, we need some more patients over there. I'm not telling you to put your patients in jeopardy, but just don't say every single one, go over there, go over to Leominster. So that has been working, and I think that has something to do with our volume starting to go back. It's not going at any record pace, but month to month, it is increasing. And as Dr. Robbins said, today, the HMOs, before you go to the doctors, you got to call. My son fell out of the tree. I think his arm was broken. Okay, send him to here, or send him to here. Or it's late at night, I'm coughing. I've had pneumonia before. Go over here. Someone will take care of you. So it has a lot to do with the physicians, and they have been working on that.
I think it has all to do with the physicians. And it's, when you look at, and from what people tell me, what's happening at the Leominster Emergency Room, although it's been getting better, but as far as how busy it was and some of the wait times and whatnot, plus trying to just navigate through that campus. A guy I work with had to go for some eye stuff Monday. We haven't seen him since then. He's still lost, wandering around. But I think I feel the same way as Councilor Fontaine. It just seems that it's easy to say, a commitment to the emergency room at Leominster. No one talks about reviewing it in 2 years, and then in Fitchburg, somehow we have to have these numbers to support it and whatnot.
Ralph, can you get excited about the $30 million we're going to pour into that campus, though?
Oh, absolutely.
I think, we would like you to be partners with us in that.
I was very pleased at what I saw, especially probably the smile that came out of my face is when, he pointed to option 1. And that made me very happy, because at this point, I did not know. And that made me happy. And everything else about it, I think we all think it's great. And believe me, we are very excited about it. But it's tempered by the fact that what a lot of us here as elected officials, from the people that we represent, and what we see just as members of this community. And it's hard to imagine a community like Fitchburg surrounded by the communities that we have around it and not have an emergency room. To me, that's an outrageous thought. And I don't care what the studies say or what the numbers say, and like I said, the numbers can be changed. And I think the onus is on Health Alliance to change those numbers by making sure that the traffic is directed here, but when it can be directed here. But I'm excited.
Good.
Annie?
What is your financial status and Health Alliance financial status? Of course, we hear rumors all the time. Are you in the black or are you in the red right now?
We're just surviving. And if you, in the endowments, they have money in a savings account, okay? And that savings account has a good amount of money in it, and it gets a lot of interest. If you take that interest away, we're in the red. Okay, so if you look at what it costs for what we get in for revenue and what we send out for supplies and expenses, we're in the red. And by taking that interest of what's in the savings account and you put that towards revenue, we break even. And we're a little bit in the black.
And when you put all of our entities together, we actually ended the year at a $1.5 million surplus because we have other branches of us that are doing better than some of the branches that aren't doing as well. The Diversified Medical Equipment Company, for example, is having tremendous success.
What you're saying is you're not getting into the principle of those cash.
No, we're not allowed. We're not allowed to do that.
And this year's budget is similar. We hope to finish the year with a slight bottom line. But also this year, we're getting $1.5 million less in revenue if we do the exact same services. So we're Annie, I think the way Dr. Robinson was presented to the board, we're doing much better than the majority of the hospitals in the state of Massachusetts.
One more last question. As you know, I've been around from the beginning, and I have to be very honest, but I'm sure it'll be no surprise to any of you that I watch my back very closely, and I watch your back very closely also. I met with the Bristol group, and Ralph and myself and the mayor met, and it was you were there. And I actually thought I gave a lot of good suggestions that I thought was good, but at the same time I did mention, and you were there, Fitchburg gets the crumbs from the table. We've been getting the crumbs for the past 6 years. It's almost we're treated like second-hand citizens, and I'm tired of it. Today, you presented, I'm very happy about the cancer unit because, you know, that's something that I think is needed. But again, when we ask a question, and I know that you can't answer directly, but it's the same kind of answers we've been getting for 6 years. Maybe in another 2 years, maybe this, that, and the other. 30 million, yes, it does. 60 million would have helped me more. You know, when you're out here and you listen to it for 6 years, it gets very tired because the board of directors change, the people that come before us change, each one brings in a different idea. But remember, I have the 6-year plan. We got a book with the rubber chicken that night. We still have it. We know what the plans were. And none of the plans that were is what has happened. I was in your hospital in Leominster. I won't be going back, but I think that people know that. I had a very bad experience in it. And I think that things have improved since then, and I hope they are. And I had a wonderful experience, as I just told you. But when we met with the Bristol group, the one thing that we all agreed on, that we blame the doctors for what is happening here. They won't send their people to Burbank. I had a friend who lives on Prospect Street, and she wanted to go to the Burbank, but her doctor said she had to go to Leominster, because that was what the order was, and that was what the driver in the ambulance had to do. He had to take her to Leominster. There was no unearthly need for it. So I think that PR is very important for you to get out, to say the Burbank is open, yes, we have services, yes, we're alive and well, and you don't seem to be doing that. Everything is Leominster, Leominster, Leominster. And I am very honest when I say that. And this is what I hear every day. And placating to us right now is very nice and it's all lovely. But it doesn't mean nothing because we're still going to wait here tonight and we're not going to get an emergency room. We're not going to get day surgery because you're taking it out of there. We're still getting the crumbs from the table. And people are tired of it. I'm tired of it. And I'm one of the most outspoken here, but I said for 6 years I've sat and listened to it. I'm hoping, I'm praying every day that you'll give us something back. And when we met with these groups, every one of the things that they suggested were social services, were the clinic. Not one of them had any teeth in it. Not one of them had something that wasn't for the lesser people. It was always something, well, we take the good, we have cream here, and we'll skim the milk. We'll give the milk to the Burbank, and we'll give the cream to Leominster. And that's what you have been doing.
I'm sorry that...
And it's true. That's the way I feel. I feel that way, and I felt that way, and I had such hope about the cancer. I had such hope that people were coming back, and I really feel that there's a beginning here. But every time I come, I get false hope, and I go back again, and it's still the same thing again. Even just when I was having my surgery, I was told, you can have your x-rays in Leominster and you can have your blood work done. And as regards getting the mammogram, it was told to my friend, you can have it done at the Burbank, but you will wait 3 months for it. It was told to her. And that's where Paul must have heard it too. And that is a disgrace. And that is going on, and the doctors are sending their people to Leominster over Fitchburg. The ambulance drivers are sending them over, and it is time to stop. And the only ones that can stop her are you people to give us better PR instead of, you know, this is lovely, but give us the PR. Get on the radio every day and say, the Burbank is open, the Burbank is open.
And
that would be good to do.
Do you see anything incongruous, though, in your saying, for us to get on the radio and say Burbank is open at the same time as you've said publicly you will not come to our service?
I said I won't go to you. No, I will not. After I was up there, I was up in your campus, and it was the most horrifying experience. But even after that, my brother-in-law was there, and he got great treatment, and I went to see him, and my heart opened a little. But when you're sitting up there with 104 fever and you're told there's nothing wrong with you, go home. I mean, you've got to start looking at who's telling you.
Well, we can't really get into individual patient things because
but I'd be willing
there
to
are
tell you
always
what happened.
extenuating circumstances that it wouldn't be appropriate
I
for
know
us
I'm
to
losing
get
it here,
into
but we're
that.
still getting the crumbs from the table. That's how I
Well,
see
I'm
it.
sorry you feel that way,
I know.
because the Cancer Center is going to be a cancer center for the entire region. It will draw from Athol down to Sterling and across. So it's going to be a huge, phenomenal economic engine in this community, beyond being something that the patients will truly cherish. We have tremendous staff, wonderful nurses, the same people who have always been there are there.
And Dr. Donnelly is wonderful. I know it's a wonderful, and it's the only thing that's keeping me going is getting a cancer center in there. I believe, I pray daily it's going to go.
Well, thank you.
But we haven't seen
A piece of dirt being put into the ground yet. And we went to your big grand opening and everything. And I understand that. It's another one of these grand openings and then plump, nothing happens.
It's coming.
Yeah.
Okay. Forgive me.
Speaking of the cancer center, I was wondering if you could touch on the scope as it pertains to your master plan, the scope of what's going to occur in the building, diagnosis. I think you've already stated there won't be treatment there.
It's going to be a complete regional cancer care center, and anybody being treated for cancer will be able to have all their treatments there. You'll be able to treat it from the oncology side, the chemotherapy side, and the radiation therapy. And the only place that you can get radiation therapy now is Worcester or towards the Boston area or Springfield area. Mary, you add more than that?
Basically, what we're looking at is being able to coordinate all of the services that someone will need. I will not guarantee you that we will be able to offer every single thing because we may not be qualified, but we are going to have diagnosis with top medical oncologists. You already know Dr. Donnelly. We are also going to be having radiation therapy. As part of our medical oncology, as far as the treatment, we now offer chemotherapy. That will continue, as will all of the supportive care.
How does that, as far as future planning, how does that affect what could go on at the campus? Are there spin-off, not to say businesses, but spin-off functions that can occur at the hospital because of this?
Yes, there are. We have looked at many things. As you talk about the physician offices, we're looking at alternative medicine, at women's center focus. In addition, as we look to the cancer center, we're looking at bringing other educational programs there.
We currently treat inpatient rehabilitation cases post-cancer treatment on our unit, and we expect that the Cancer Center will cause a spin-off of additional patients for us in physical medicine as well.
Okay. Thank you. Any other questions?
Dave, how about the agenda? Where are we?
And
Yeah?
a little while ago, you mentioned that you'd like cooperation from the council. And I don't want to even start where Annie left off, because I think she said just about what I would have said. But I would like to feel a little optimistic here. At my age, I'm not going to see Burbank Hospital as it used to be. And unfortunately, I think we lost this back in '90, when the board decided that Leominster was the place to go. It's obvious to anybody who looks at the Burbank campus and looks at the Leominster campus prior to them doing what they've done now and what they're still going to do. It's just unbelievable. And we can sit here and argue that night and day that is not what happened, but there's no doubt in my mind, and there's no doubt in the councilors that I was on, that we lost it when the board decided to throw the mayor off, throw our president off that board, and elect their own board from Leominster, and that's where it went. No doubt in anybody's mind, with common sense, looking at both campuses and seeing the money spent at Leominster, and as opposed to what they had up in Burbank Hospital, you don't need to be a brain surgeon to see what kind of a mistake they made. The mistake was made, so it's there. Whether this will bring it back, Do we have confidence in that? I would like to believe Dave and what he's in his remarks and your remarks and Eldon's remarks. But we need some facts. We need somebody to come in here and say, this is what's going to happen. And hopefully this is what you're going to be doing tonight. And, it's too bad you came here tonight. I guess the frustration of the council was waiting. God, we can only get him on, come in before us, we can really go after him. And I think that's part of the frustration. That's part of the frustration that we have. And we just keep going on and on and on and on, but we always end up, as Annie said, we get the crumbs. We have one of the best hospitals in the country up in Burbank Hill. It was always, and Annie, you've been around long enough to admit that was one of the best hospitals in the country. I'm finished for the night.
Yeah, I just wanted a quick, I know you had said that, and I just want to address what you said. I want to thank you for coming. One of the reasons that I called you and tried to set this up was basically because of what we hear. A lot of what we hear is rumors, and a lot of times we don't hear what is the truth. And I wanted, this to occur so at least you could present, we could ask questions, and everybody's on the same page.
Yeah, and we would, we'd be very happy to have you come up to Burbank, and, this is a partnership. We're trying to serve you, and we need you as much, hopefully, as you need our healthcare system. So please feel that, Eldon, as the administrator of Burbank, is certainly a person. Did you bring your cards, Eldon? Perhaps people can call him for, you want to do tours or whatever. I'm certainly available. Mary, we're all known to you. We're not, from another planet. Thank you. I was going to say another space. I guess it's like, we're not from another planet. We're the same people we were 2 years ago and 10 years ago. So please don't hesitate to call us.
I know, I want to get to that.
Alan, give them all your...
There's been a lot of questions in relation to the ambulance. We have signed a lease with a landlord on 3 Berry Street. We're going to install the paramedic ambulance, or the ambulance there. The reason why we did not do it on the Burbank campus at this time was simple, that we are doing so much planning, and in order to put it on the on the Burbank campus, it was in excess of $100,000, and we knew we were going to put it in the wrong spot, so we rented a spot that is directly very close to the custom auto body, and it's about 30 yards from Lunenburg Street, and we've worked it out with the Patriot, and we should have the ambulance in there. There's some work that needs to be done. The garage door needs to be put on by the middle of January, and it should be functioning out of there in a heated home, heated cell for that.
David?
Yes.
If I may ask the building inspector, or the building department, Mike Gallant, when I spoke to him, Mike, is there such a thing as 3 Berry Street?
I couldn't find 3 Berry Street on the map.
Pardon me?
I couldn't find it on the map. 3 Berry Street was also known as 173 Lunenburg Street, the location of Rocco Stellas.
That's the property, and on the lease it says the address is wrong? Okay.
Because 3 Berry Street would have been an empty lot.
Okay, that sounds right.
That's why they need the garage.
I looked for 3 days and found the right address on it. Dave, can I just wrap things up with my little... given the fact that it's 9 o'clock, and I'm sure that people have a certain saturation point. We could go on forever because we eat, drink, and sleep all of this, but what I wanted to do is let you know how our capital campaign is going. And I have to tell you that it has been an extraordinary experience. I'm not here to solicit you. I thought, shall I bring pledge cards or shall I not bring pledge cards? And I didn't. But I do want you to see the case that we have developed. So far, we have completed what we call the family phase, which means all those who are closest to us internally, our physicians, our employees, our guild, et cetera, those who are with us, on a daily basis, our trustees. And having only started a few months back, maybe 6 months ago now, we have reached $3 million of our $5 million goal. Now, that goal, in my mind, is only the minimum goal, because as Dave was saying, things like this machine costs $750,000, and the numbers are just astronomical, and there's no such thing as ever being able to get too much money from us as far as they'll go. We've just begun at the stage that we're calling the public phase, and in that stage, we go now to the business community, who of the past 10 businesses I visited before Thanksgiving, 9 companies came in with excellent donations. $25,000, $50,000 donations. We're being warmly received, and I thought that might be encouraging to you. The $5 million goal, I hope that we will reach by June, and then perhaps even before then. I'm an optimist. My cup is always half full. Others may choose to have theirs half empty, but for me it's always half full, and I think it has been a tremendous experience. Our employees have donated over $157,000 to the campaign. Our physicians, $1 million. Our guild has pledged $1 million, $500,000 to go to the Burbank campus for cancer services, and $500,000 to Leominster for surgical daycare. So we feel the support. I know there are some people who perhaps, as you've expressed, have some dissatisfaction with how everything has shaken out, but truly, this is our healthcare system, and we're very enthused with the reaction we've received so far. So when we wrap up the business community, which probably will go on for 3 or 4 months, then we will move into grants from foundations and from the federal government, the state government, et cetera, and finally, we will go to the community at large in the summer and the fall of next year. So I'm hoping that we will exceed every possible goal, and every dollar that comes into us is appreciated and cherished. And we have received some wonderful bequests in the last week, and the news is all positive as far as I'm concerned, because we really are on the move. We're excited, and I hope that you can be excited with us. Thank you for having us.
Thank you.